Well, I've always been a naturally curious person. I always like to learn new things, traveling to different places, trying on new experiences. I grew up playing basketball and softball. My passion is really to work in that team environment. Running around, being able to play the game, but also doing it with a common goal. I think that carries over into my nursing world because problem solving is what nurses do all day, every day. It's just extremely rewarding to me. I'm Allison. I am the Chief Nursing Officer at Mercy General Hospital, part of CommonSpirit Health. I still remember the first sound of my daughter's cry.
Say cheese!
Cheese! My husband and my mom were right there to support me, and for my own health reasons, I was in the hospital for a couple of days longer.
Oh, let me try to find it.
Just the gravity of the illness I was facing really left me in a vulnerable place. What I learned in that experience was the nurses were a tremendous amount of support. I thought to myself, when I leave the hospital, I really want to commit myself to making every patient's experience better. I feel like it was a gift for me to experience that, because if I felt that sense of love, I knew it was possible for every other patient to feel that.
And then the receiving nurse signs off on it.
So we looked at the evidence that's out there in nursing. We did classes, we did role play, tasted all of the food that was prepared in the kitchen. We had our transportation team ride us around on gurneys all throughout the hospital. We had the nurses simulate doing a full admission. We began to go through the different departments and offer these classes for every single nurse in the department. And what we noticed right away was our scores in that department from a nurse communication perspective went sky high. And we thought, oh, we have something here. Hi, good morning. How are you today? As nurses, we work with patients in a really vulnerable state. And for me personally, I knew as a leader, I could really impact more lives.
Some beds do, some beds don't, so maybe...
My job is to take care of the nurses so they can take care of our patients. These are people that are willing to go that extra mile to make sure that that patient experience is the best that any patient could ever have. That's what human kindness is to me.